Hello, everyone. Thank you for coming and joining us today, both in the room and remotely. I'm James Jeffries, and it's my privilege to work on empowering care teams in healthcare with this remarkable product, Dragon Copilot. I'm going to be walking you through an overview of Microsoft Dragon Copilot today, and then we'll be joined by my colleague, Maria, who will steal the show with a demonstration. And I think right up front, I just want to say that if you've been looking for examples of AI making a real impact out in the world and in industry, this is it. Dragon Copilot is a hardened solution that's delivering value every single day, day in, day out, doing critical work for healthcare providers out in the field, to the extent that we get unsolicited feedback regularly about how this solution has saved clinicians from burnout. It saved them in the profession of healthcare, keeping them in the field longer than they intended to stay. Because of that, the script is really turned upside down for AI with respect to Dragon Copilot. It's not that this is pushing people out of work in healthcare. Instead, clinicians are doing more human medicine than ever when they're backed by a clinical assistant like Dragon Copilot. I'm going to be telling really two stories in what follows. One is the story about Dragon Copilot, this clinical assistant that is delivering a solution at the point of care. The other is about how Dragon Copilot opens up a new channel for partners to deploy and scale their own solutions to this wide and increasing number of healthcare users. Then, in a similar story, Maria's going to show off how Dragon Copilot works in the field and how it extends with our partners. But first, I want to spend a little bit of time on the problem space that we're addressing. Right now, if you've been in the healthcare industry for a while, this picture might be familiar to you. It's now about a decade old. It was drawn by a 7-year-old to depict her visit with her family to the doctor. And what it's showing is our little patient on the right-hand side with her family. And then on the left-hand side, you see the doctor hovering at the computer, his back turned toward the patient, desperately keeping up with this administrative task. Now, what this is ultimately a picture of is a kind of a failure, a second-order consequence of introducing technology into healthcare that ultimately diminishes the opportunity to provide care to a patient. So you can kind of follow the thread logically. Once a doctor is turned into an administrator in the room, working at the computer, then their quality of life goes down. They're no longer practicing medicine like they originally intended. They're no longer looking the patient in the eye and doing that work. They're also overwhelmed with tasks in these multiple modalities, these systems in which they're working. That has downstream consequences for the care for the patient, both the one in the room that they're trying to work with because they're not paying as much attention as they could otherwise be paying. And then at a macro level, there are fewer patients that are able to be seen. Patients are dissatisfied and they're leaving and shifting around health systems. So let's pay a little bit more attention to this burden that doctors are facing. All of us in the room are very busy professionals, I'm sure. You are receiving emails and Teams notifications right now. I'm sure there are some of you looking down at your phone, trying to multitask, trying to stay on top of the wave of burden that you yourself face. Now project that into the life of a doctor. They have the same set of problems. They're responding to messages all day long. But it's not just that. They also have to write documentation for every single visit with their patients. They have to sign all of those notes and get them out so that you get the care that you need. They have to conduct research on their patients that are coming in, sometimes digesting and synthesizing across literally decades of patient information in order to know how to appropriately treat a patient. They're navigating all of these technical systems. They're drafting referral letters, they're interacting with colleagues, and they're influencing downstream processes like billing through codes, appropriate levels of documentation, documenting in just the right way to support the care plan that needs to be paid for ultimately by insurance. So there are a couple of really important differences between the amazing load that's pressed down on our healthcare professionals and probably most of us in this room. One is they have this diversity of work that they have to do, of course. But it's also the case that every one of these tasks has enormous consequence for the patient in the most significant possible way, for their health and for their financial well-being. And so the load is enormous that they're dealing with, and the stakes are very high at every stage. So how can we help? Enter Dragon Copilot. This is our aspiration to bring joy back to the practice of medicine for all of our users by offering a solution addressing those problems we saw on the previous screen. We think we can do it incrementally, and with the help of our partners, we can, in fact, build solutions that address, in each case, that enormous burden that clinicians are facing. Now, at its most basic level, Dragon Copilot is a collection of really advanced technologies. You have voice dictation, speech to text, and you can think of that as more than just dictation. Put your cursor into a field and speak, and you get text there. That's been a traditional practice for documentation in healthcare for a while. But it's also being able to issue a command and have the system understand what you're saying and act on your behalf. That's on one side. The other side is ambient listening. So you walk in to see a patient as a doctor, you record the conversation and let Dragon Copilot take care of the documentation end to end. It's going to hear the conversation, write a transcript, process it into a note, identify all of the orders, and queue them all up in your EHR by the time you get back to it. And there's this foundation then also of generative AI capabilities that support and integrate these additional technologies. So you're going to be able to support knowledge work, ask questions that understand the context of your patient and all of your favorite privileged, trusted resources in medicine to help you answer questions in the fastest, clearest, and highest quality possible way. You should see reflected in this not just technologies, but also experience patterns that are required for a full AI clinical assistant. A great assistant is going to be able to take instruction. It's going to be able to do literally exactly what you ask them to do without a lot of additional explanation. A great assistant is also going to be able to step back into the corner, listen and understand every word, and act on implicit requests, surface information, do things on your behalf. And a great assistant is going to be an interactive partner. They're going to be able to ask questions. They will ask questions back. They can go off and do research and come back to you and get your review. So you're also seeing a really full-bodied and robust assistant in development here with Dragon Copilot. It's because of that robust set of capabilities that we can expand the reach of Dragon Copilot out into increasingly more users, personas, and cases in healthcare. So we've started with physicians, we're moving into nursing, and we can see very direct paths down to the rest of the care team in healthcare systems. So what do you get out of Dragon Copilot? It makes the biggest difference. Now there are a lot of them, and many of them are related, so I'm going to call out two themes. The first is quantitative. You can see in the second column, we reduce time spent on documentation. That's a pillar of what Dragon Copilot does. And when a physician, a clinician walks in and allows Dragon Copilot to do the documentation on their behalf, they're going to save about 5 minutes per visit. Now you compound that over 20 to 30 visits for a single clinician in a day across all of the clinicians in the health system, and pretty soon you're counting in hours, and days, and weeks, and months, to the extent that we, in measuring the effect of Dragon Copilot, can measure our time and lifespans saved. Now, what do you do with all of that time? You give it back to healthcare providers so that they can get their nights and weekends back. That makes them much happier. You can give it back to patients so you can see more patients in a day. That makes the system better. That makes more patients' care improve. So that's quantitative. Now, qualitatively, if you walk in, you see a patient, you let Dragon Copilot listen to the recording, generate that documentation as your draft, then you've also turned that doctor around in their seat. They're no longer, their back isn't facing the patient anymore. They're connecting face to face, having a real conversation, and practicing medicine as it was intended. So delivering these benefits, Dragon Copilot has 3 big areas where it's making an impact. We're streamlining documentation, all of those processes along the way, surfacing information in brand new ways, leveraging the healthcare adapted generative AI, and we're automating tasks throughout the workflow for our users. Now you should think about how all of this is a big opportunity, not just for our users, but for all of our partners to start to implement new features and scale them across the user base for Dragon Copilot as well. The scale doesn't stop with just the capabilities, though. We're also implementing Dragon Copilot across all of the specialties and subspecialties, across all of the care settings that you can imagine, and we're making it available, it's already available, in all of the modalities in which healthcare clinicians are already working. So think availability on web, or in the mobile, or on desktop, or in the EHR via connections through integrations or embedded inside of an EHR. We've also built an optimized copilot for healthcare that enables you to interact with it on a wide range of intents or in a wide range of ways. So you can ask questions taking the patient context into account. Again, you can conduct research that's using your favorite resources. You can also generate new artifacts on the fly that you need to, referral letters, patient instructions, whatever you need at the point of care. All of this in workflow or before or after your encounter. And of course, you can customize or style your own experience in the ways you need for your specific practice. Based on this raft of capabilities, the scale that we envision for Dragon Copilot, we're really happy to announce the availability of nursing optimized Dragon Copilot at the start of December. What's the optimization look like? Well, we have now optimal data extraction that helps to fill in flow sheets, one of the most tedious workflows, but necessary for nurses. So now we can move from the story of Dragon Copilot on into the opportunity for partners as well. And the base foundation is that we have developed Dragon Copilot to be an open garden for our partners. That's software development partners, it's system integrators, it's EHR partners, and it's customers as well who take an interest in building unique features or solving the problems that their health system uniquely sees. So you can imagine all of the possibilities here, and we already have a significant set of partners who are building features across clinical insights. So think clinical decision support, vocal biomarker analysis, additional trusted sources like from Wolters Kluwer or Open Evidence, on into downstream revenue cycle management support. So think about pre-authorization for insurance, or coding analysis to ensure you're going to code and then bill at the appropriate levels. We also have partners working in telehealth inside of and in patient experience analysis, patient sentiment analysis, using all of this incredible data that's generated in the course of a an interaction between a doctor and a patient. And finally, we back this with administration that is effective for both partners to build, deploy, and command an experience, and for customers who need 𝗦𝗻𝗀 to be able to administer the experience their end users have at an enterprise level and enterprise scale. So I would like to leave you with some of the comments that we're getting, the feedback we're getting from our customers. And the most importantly is we are making the quality of care improve for patients. We're enabling an ecosystem of innovation in Dragon Copilot. We're improving the face-to-face interactions that healthcare clinicians have with their patients. We're taking all of that data that's coming in and making it useful automatically and without the requirement and the burden of constant interaction from the clinician. So this is our big aspiration, and I'm happy to turn it over to Maria to give you a demonstration.
Great. Thank you, James. So for our live demonstration, everyone, I'm going to need the help of a volunteer, and Tulsi has actually volunteered, so if you don't mind coming up, Tulsi, I appreciate your help here. We're going to do a mock clinic encounter between a patient and a provider. I'm going to play the role of provider, and Tulsi's going to play the role of my patient. Thank you again. Now, you know, I've got a busy day ahead of me, and in the clinic, I'm going to see patients after patients. So I will use Dragon Copilot in my mobile application to document my notes while I engage naturally with my patient, Tulsi. So you ready, Tulsi?
Yes.
All right, let's do it. So Tulsi is here. She is a 25-year-old female. She's in for evaluation of her left shoulder pain. Tulsi, tell me what's going on.
Oh, I have been experiencing this pain for the last 3 days. I did a heavy workout, and then it's gotten progressively worse.
Okay, all right. And then have you injured that shoulder before?
No, this is the very first time.
Okay. And then have you taken anything to help relieve that, or does anything relieve it?
No, not really. It helps if I do a cold compress.
Okay.
But not for very long. The pain comes back.
Okay, all right. And then do you have any other symptoms? Like, are you feeling any numbness, tingling down your arm?
No, nothing as of now.
Okay, great. So I'm going to take a look at you. I'm going to do a physical exam on you real quick. I'm going to actually start with your left shoulder here. Okay, so I do appreciate some effusion on the anterior aspect of the shoulder. You'll hear me say medical terms, but I'll explain to you what they mean later. Can you do me a favor and put your arms out around outside? Like, there we go. Okay, does that hurt when you do that?
A little.
Okay, so there's some slight pain to abduction of the left arm. And then if you put it across you, does that hurt?
Yes.
Okay, so there is pain, positive to pain to adduction of the left arm. So let me go ahead and listen to your lungs and just make sure and your heart, make sure everything else is okay. Okay, great. Everything looks normal. I do notice, though, on your vital signs that your blood pressure is a bit high today. It's 165/88. So is that normal?
Not really. I think I'm just a little nervous about being evaluated publicly.
I understand. So, all right. So let's talk about my assessment and plan. So for your left shoulder pain, my impression is that you are having a left shoulder strain. It sounds like from your activities that you've overused it. So what I'd like to do is a couple things. I want to recommend 𝗦𝗲𝗀𝗀𝗃 to help with the pain. That's going to decrease some of that inflammation and decrease the pain. And then I would like to start you on physical therapy. So I'm going to refer you to physical therapy for some strengthening and stretching exercises, okay?
Sounds good.
And then for your blood pressure, I just would like for you to monitor that at home. Do you have a blood pressure cuff at home?
Yes, I think I can find one.
Okay, great. And then I want you to follow up with me in 3 weeks about your blood pressure, and we'll also then check the extent of your shoulder pain to make sure that the medication is helping you, okay?
Okay, thank you.
All right, thank you so much, Tulsi. All right, so as I stop the recording, I actually now have time to continue with my other work. So I can finish writing up prescriptions, I can place orders, I can even respond to referrals, and then even see my next patient and stay on schedule because the documentation for that particular visit has already been done for me. And then when I'm ready to review the note, I can easily do so anywhere. So Dragon Copilot follows me wherever I go. I can access it through my mobile device. I can also access it through the web or the desktop. So let's go ahead and review that note. So we see here, I see that it looks pretty good. It took all that clinically relevant information, it placed it in the appropriate sections of the note. I don't see any of the any kind of banter that got included. So yeah, I think it's pretty good. If this is all right and I don't need to do any edits, it's ready for transfer to the EHR. Now, Dragon Copilot is adapted to a provider's specialty. So that helps streamline that documentation because with those specialty models, it captures the nuanced details and also structures the notes based on a specialty. So for example, I am a primary care provider today, that's what I played, but if I were an emergency physician, my documentation would require specific charting elements. So for example, they would need to have information like disposition or the ED course or also differential diagnosis. But with the specialty models, I can entrust that my note as an ED physician is going to include all that information. Now, some providers also would like to further optimize their documentation just to add that personal style of documentation to reflect their own style. So I can easily do that as well. So through customization, I can set up to auto-run certain personal style changes that I would like. So for example, I actually like my physical exam in a certain structure. So I can easily apply those customization from my library. And this customization leverages generative AI prompts to tell Dragon Copilot of how I really want my output to look like. So you can see here that it added additional formatting, let me show you the physical exam here, and in additional formatting to my documentation. Now, there are times when also throughout my workflow, I would need to query information about the visit. So about my visit with Tulsi, I wanted to just kind of recall to see what were the patient's symptoms prior to coming into the clinic. So with that, Dragon Copilot actually surfaces information so that I can glean information from the visit, I can glean information from trusted sources right within my workflow. I don't need to go to different places to find that information. It's right here as I am working with this particular case. So I mentioned also that I can tap into trusted sources, grounded sources. So we connect with partners such as Open Evidence and soon to be 𝗦𝗲𝘀𝗀𝗃 to be able to really get information on that's medically relevant, right? Or information on diagnoses, treatment plans, and evidence-based content. And how I do that, again, is through this healthcare optimized capability that's within Dragon Copilot, which is the Healthcare Adapted Copilot. I can ask, for example, what is the first line of treatment for left shoulder strain? And that will tap out into the connections, such as those trusted sources, and surface that information so I can get more information about relevant clinical situations that my patients may be experiencing. Now, this also serves as a platform for healthcare organizations to use their own trusted sources. So for example, their internal hospital policies and procedures. So again, it's a scalable platform as well as being able to surface information right within my workflow at my fingertips. And then lastly, I have the capability to create new outputs. So from here, I can quickly draft a visit summary or referral letter from that conversation. It pulls those details. This helps me automate those administrative tasks that James was talking about that many providers have to go through. So for example, I can write a referral letter quickly from that conversation, or I can even extract orders from the conversations. This helps me, again, with those repetitive tasks that will kind of slow me down during my workflow. Now, you've seen how I was able to streamline my documentation, surface information, and also create new and outputs that is relevant to the case. So I can even use intent-based capabilities to say, give me a list of the diagnoses and ICD-10 codes that's pertinent to this visit. So I can help, complete my work by using all these capabilities. And what this is going to do is allow me to create new outputs, or outputs that are needed to really provide the ultimate optimized care for my patients, and to make sure that my documentation as well is complete. Now, beyond that, Dragon Copilot also offers a healthcare AI workspace that is extensible. So what that means is it invites plugins and first and third-party integrations and opens up that partner ecosystem. So for example, we can also infuse a first-party integration with a clinical conflict scheduling. And what that does is it takes the information and alerts the provider if there's any discrepancies, if there's any contradictions to the medical documentation. And then from that, that's going to help improve, for the physician, improve accuracy and reliability to the patient record. It helps reduce those medical errors. It also helps boost that diagnostic confidence. Another example of extensibility is through our integration with Canary Speech. So Canary Speech provides analysis of voice biomarkers that's captured from Dragon Copilot to detect early signs of cognitive or behavioral conditions like Alzheimer's or anxiety and depression. And then that gives the clinicians timely and also compassionate care. And then 𝗦𝗲𝗀𝗀𝗀𝗀 is another one that James mentioned, which can provide prior authorizations right at the point of care. So for 𝗦𝗲𝗀𝗀𝗀𝗀, for example, they provide prior authorizations and alert providers when they order certain exams, such as or a surgery like total hip arthroplasty. And from there, that accelerates that scheduling, that streamlines that workflow, and then also eliminates those delays in the whole process. So you've seen how we've been able to seamlessly integrate with partners, and we've also seen how Dragon Assistant helps that clinician and empower them to really focus on what matters the most, which is really provide exceptional patient care. So that said, I'm going to hand it back over to James to conclude.
All right, thank you, Maria. And I'm flashing again the screen of what we're hearing from customers about the great impact that Dragon Copilot is having out in healthcare today. And certainly it's our major invitation to any partners out there to start getting involved in treating Dragon Copilot as your own open garden for development on into the future. If you haven't already, please do seek us out in the hub to learn more, and you can follow the AKA link to learn more about Dragon Copilot as well. So thank you very much.